Entitlements like Medicare be on the chopping block in order to strike a deal on the fiscal cliff. After spending more than $486 billion on Medicare last year, experts say it could be the next program to go bankrupt. So is raising the eligibility age the answer?
Dr. Donald Palmisano is a former president of the American Medical Association and author of the Little Red Book of Leadership Lessons. He joins us live from New Orleans. Saints helmet perfectly placed just behind him. Good to see you, Doc.
Good seeing you. Dave and Allison, how are you doing?
We're doing great. And a lot of people, certainly Republicans, talking about raising the eligibility age for Medicare by at least around 2 years. But you point out there are both positives and negatives to that approach. What are they?
Well, first of all, something has to be done. Medicare has a broken engine. We can't continue just to put oil in this leaking engine. We have 50 million people on Medicare right now, and we're adding 10,000 people a day because of the baby boomers joining. And last year we spent $549 billion on Medicare. And so if you look at two sources, one, the Congressional Budget Office, and the second source, the Medicare trustees, and we can say that those are nonpartisan groups, they're saying that Medicare will be bankrupt in 2024. Okay. And that's based on the assumptions that what will happen is that we're going to do this price cutting physicians in January 27%. So if you raise the Medicare age to 67, what you have to do is to give some notice so that you don't suddenly have a detrimental reliance problem where people about to get on Medicare suddenly find that they can't get on Medicare. So you got to move that in gradually. But that would be a step in the right direction, certainly. And the other thing would be to put Medicare into a defined contribution or a premium support model, which, by the way, I'm not speaking for the AMA now, but AMA is in favor of that, and several former presidents of AMA, Dr. Johnson, Dr. Plested, and I, for a long time have advocated this.
You say that one thing that would really help is for people to take responsibility for their individual health care and make the right decisions. What does that look like?
Yes, absolutely. What we should do is get competition in the mix. There's really no competition now in Medicare. If you tell everybody they can get an automobile, they're not going to pick a used Yugo. They're going to go out and buy a really nice car, an expensive car. So what we need to do is make the individual patient, let the patient think about being fiscally responsible. What's a good way to do that? A health savings account would be available to many people with high deductible insurance over that. And I'm afraid with the Affordable Care Act that option may be knocked out because they're not going to count the money that the individual puts in to the health savings account as part of the ratio when they look at expenses and payouts and so on. So we need to acknowledge that there's a problem, that Medicare is going bankrupt, and we need to come up with a solution. Raising the Medicare age, converting Medicare to a defined contribution or premium support, having competition across state lines so that we don't get one insurance company with so much power out there they control what they pay or what services they offer. Let's have something like the Federal Employees Health Benefit Program that the people in Congress have.
If only we had some elected officials who would discuss changes to entitlements.
Well,
that
we got to
would be
stop
a good first step.
Yeah, right. We got to stop all the rhetoric and all the games playing and get down to serious business.
Yeah, got it. Dr. Donald Palmisano, thanks for coming in with your expertise.
Thank you very much.
All right, coming up, they